Hi, everyone, and welcome to today's Ask Humber session on taking care of your wellness on campus with our Student Wellness and Accessibility Center. So before we dive in, don't forget to give this video a thumbs up and subscribe to Humber Polytechnic's YouTube channel so that you'll never miss out on all the things and exciting events happening here at Humber, okay? Keep in mind the chat is open, so if you do have questions, we do have our experts here moderating the chat. So, throughout the presentation, feel free to kind of type in your questions there. And I'm thrilled to welcome our special guest, Jeffrey Nolan, who's the Accessible Learning Officer here at Humber. So he's pretty much here to share everything you need to know about student wellness and accessibility and all the amazing services that they have to offer while you're a student here to support your success here at Humber, okay? So I'm gonna kick off the session with some kind of general Humber information. So most of you are probably wondering, what is a Polytechnic? A Polytechnic, this education kind of gives you the best of both worlds. So it's a perfect blend in between college and university, where you get a solid academic knowledge that you expect from a traditional university, plus the hands-on real-world experience that you would find at the college level through work integrated learning opportunities. These opportunities give you the experience that helps you kind of hit the ground running after graduation in order to land that job and ultimately your career. So in terms of our campus locations, we have 3 major campuses. So our North Lakeshore, which is in the west end of Toronto in Etobicoke, and then we have our downtown campus. We also have our Carrier Trades campus close by to our North campus, and that's where you'll find all of our trades related programs. So here's our North campus. We have over 20,000 full-time students here. We do have a residence for about 1,000 students. So if you are interested in staying on campus, we do have that opportunity for you. And at the residence at the North campus, we have single dorm room styles as well as suite styles, okay? And then your backyard is 250 acres of kind of wilderness. So that's our 250-acre arboretum with amazing trails. Many of our programs also use this as kind of the lab spaces as well. Then we have our Lakeshore campus. So if you travel down south, you'll hit right next to Lake Ontario. This is our Lakeshore campus. We have about 12,000 full-time students here, and we do have a new residence, which houses about 400 students. At the Lakeshore campus, our residence is a little different, where we only offer suite style rooms. Then we have our downtown campus. So the newer campus of the 3, which is located in downtown Toronto, right at close by Yonge and Bloor. And this is where you'll find graduate level programs. We have now diplomas as well as some certificates. If you are interested in kind of seeing and visiting any of the campuses, we do have campus tours that you can book Monday to Friday online. So a great opportunity. We always tell students, you know what, before you buy a pair of shoes, you should try them on. Before you buy a car, you'll test drive it. Same goes with your kind of post-secondary experience. We always encourage students to kind of visit the campus, get a feel for it, and see if it's a right fit for you, okay? So that's it for me. I am going to turn it over to Jeffrey. I know this is the information that you all have been waiting for. So Jeffrey, the virtual floor is yours.
Okay, thank you. So this is about student wellness and accessibility, and I'll concentrate a bit on accessible learning services. So what is SWAC? Student Wellness and Accessibility Center, SWAC for short. SWAC facilitates individual student support in addition to wellness and equity-based programming. So rather than equal-based programming where everybody gets the same thing, the support is equity-based, meaning it's what someone specifically needs in order to do what they do at school. So where is SWAC? At the North Campus, we're on the second floor of the Learning Resource Commons, the big main building at the front campus. We're on the second floor opposite the elevators or at the top of the stairs. And at Lakeshore Campus, we are also on the second floor of the Welcome building. And we are next to the elevators, not across from them. But if you find the elevators, we're nearby on the second floor. The services we provide are currently offered in person and remote, by phone, by Teams chat. We try to make it as easy as possible to connect. So what are we? So we are mental health and counseling and the health center and accessible learning services. And I'll go right into mental health and counseling. You don't have to have a problem to go see someone in mental health and counseling. You can be working on something, building skills, getting support around an issue that's particularly anxiety provoking. But you can discuss mental health needs and resources geared toward your specific concerns. Your meeting is same day booking. So usually if you pop in the morning or call in the morning, you can usually be seen that day by somebody, and you start with the clinical nurse specialist. If it's late in the day, you'll probably get on the roster for the next day. So the clinical nurse specialist will meet with you for 30 minutes. This is all free and confidential, which all of SWAC, everything you do there, your appointments, what you disclose, that's all kept confidential. We don't share that with anyone. And I'll address that again shortly. And as I said, by remote, phone, and in person, their appointments are Monday through Friday. So if you'd like to book with them, you can call or stop in or email. The easiest one I think to remember is our email there at the bottom, swac@humber.ca. It's pretty easy. But if you need to call, 416-675-5090 is at the north, 416-675-6622, extension 3331 is the Lakeshore. The health center. So it's doctors and nurses, as you might guess. So they do first aid and emergency treatments, not real serious things, but things that they can be treated on the spot. They do STI testing and treatments, emergency contraceptives, health teaching, consultations, birth control, sexual health. And for full-time students, they do vaccinations and check reactions to vaccinations. The doctors are, if you currently don't have a family physician, you can book an appointment, and the appointments for the doctors are running about 2 weeks out. So it'll be like a week or two before you get in to see a doctor. So, plan ahead. So the health center, you connect pretty much the same way. And like I said, swac@humber.ca is the easiest way to remember that. But you do need an appointment to work with the health center. So accessible learning services. We facilitate equitable access by coordinating academic accommodations and support services. So we help identify barriers to access, including physical barriers. But for instance, if you were a blind person and you had a lot of textbooks to read, you would need access to that textbook. So our supports help you access your class material in the same way that anybody else would in your class. We establish appropriate academic accommodations and assistive technology. And we have assistive technologists to work with you to see what will work for you and then train you on that. So it's not just a rubber stamp or go out and buy something that would be helpful. It's not a suggestion. We'll show you what you're doing, see if you want to use it or not. We assist students to understand their accommodations and how to use them effectively. We have a number of students who may have had an accommodation, for instance, in high school, but they didn't really need it or didn't really understand it. So if you're at college or university, understanding what that is and how you use it to your best benefit will come up more and more often. Like you wouldn't be given something that just isn't used. You'd be supported in a way that works. We assist students. We connect students to other on-campus services. And I'm sure, as you're hearing, there's lots of other on-campus services. This is not an exhaustive list, but this is some of the disabilities we're working with right now. About 45% of our folks have specific learning disabilities, so dyslexia, central processing disorder, dysgraphia. About another 60% are people with mental health conditions such as anxiety or depression or bipolar disorder. And many of our students have more than one disability, so we are accommodating more than one at a time. But also there's, as I said, blindness and low vision, medical conditions like diabetes or arthritis, brain injuries, autism spectrum disorder, and temporary injuries. If that comes up for you, hopefully not, but if that comes up for you, there are supports around temporary. A good example of a temporary one would be if you got a concussion playing sports or something, and that limits your screen time and things like that. So there are temporary accommodations to be put in place to help you get through that period until you're well. Rights and protections and confidentiality. So health, mental health and counseling and accessible learning services have a responsibility to maintain the strict confidentiality of a learner's personal health and information. And there are laws guaranteeing the accommodation of somebody as well as keeping their privacy. So we only share information internally associated with continuity of care. So if you needed to see another part of SWAC, or we needed to say, hey, there's another part of SWAC that you can visit, we can connect you. That would be done with your permission. But yeah, if a teacher called us and said, what's the disability for this person so I can understand them, or if a parent called and said, did they attend the appointment, we don't share any of that information. That stays put. So as it says at the bottom of the slide, we don't share unless the learner tells us what to share and with whom to share it, except if required by law to do so. So why connect with ALS? So you can find out how you can be supported in post-secondary. A lot of people visit us and say, I never knew this existed. Well, there's supports that you can use, and they're free and they're private for the most part. Your professors would know about accommodations because they're providing that accommodation, like extra time on the test, but they don't know anything else about you because unless you want to tell them that. So you can set up the academic accommodations and learn new strategies. Of course, with new supports, you have a new strategy for learning, and that should be helpful. Share your past experience with accommodations, what worked and what didn't. We do have a number of people who said, well, I had accommodations in high school, and I didn't like the way they treated me. It was humiliating. All my teachers were nasty to me. So that's something you would work with ALS and bring up and say, okay, this bad thing happened. I don't want that to happen. So if I get support, is that going to happen again? That's something you would bring up and discuss, okay, how does that play out, or how exactly do you want that to play out? So ideally, that's not going to happen again to you. You'll have a better experience, or you're choosing the support that you want. And you would learn self-advocacy skills and the ability to problem solve. You'll be working alongside a staff usually who can advocate for you. And while they're advocating with your professor or your associate dean, they would be modeling what you need to see in order for you to do that. So when you graduate and go into the workplace, you'll be able to self-advocate and do the problem solving. You'll be able to say, this is what I need, this is how it's done, this is where you get it. So why connect? So if you return to Humber, Polytechnic, or Guelph Humber and are in an OSAP eligible program, you could have access to disability related funding. It can be used for assistive technology, disability related, not just any technology, but it has to help you with your disability. Ergonomic equipment, or if sitting for a long time or standing for a long time is difficult. New assessments, disability related services like counseling or coaching, and disability related grants. OSAP offers a grant if you have a permanent disability on file with them. And that is very helpful because they make the admission that going to school with a disability is more expensive than just for a typical student. So there's financial stuff that will help you with that. So what will my accommodations be? We get that a lot. And there's not a list. We don't go down a list and say, you can have these 4 things or something like that. It's more like, well, what do you need to do? What's your disability? It depends on you. So it depends on supporting documentation, outlining functional impacts. So how does your disability affect you? Then how will that affect your learning? How will that affect you getting to class? Your accommodation history, what worked before, what will work now. Some things that you've used before are irrelevant in college, so you'll get something new to support you in place of that. And then current program needs and learning outcomes. Having a disability doesn't exempt you from the learning outcomes of each of your classes. So you will be doing what everybody else in the class is doing, except if your disability is impacting that, you have a different way or a supported way to do the same thing, but you still achieve the learning outcome. So documentation. These are the most common types of documents learners present. Psychoeducational assessment or psychological report, individualized education plan or IEP, Humber's medical report for academic accommodations and services. That's like a long doctor's note with a very detailed grid that helps show how you're impacted. And medical notes from regulated healthcare practitioners indicating those functional impacts. How are you impacted by this? Your documentation can be any age to get started. It's helpful to have that, so always try to show it if you've got it. And but even if it's old, bring that anyway. Once you meet with somebody, if they need something else to set something up for you, they'll say, "This is what I need." So you can always get started. Even if you have no documentation, you can get started with us. But these are the usual ones that people have. So if you've had one of those, that might be helpful for this meeting. So how to register with us? You can use the QR code. That's the fastest. The link is at the bottom, the bit.ly ALS intake. So do the online intake. It gets it shows what's going on with you, what you've experienced, and what documentation you have. So you can just get to talk about yourself. You choose a registration option. There's a transitional option, which is quick. There's no appointment. You set up accommodations and they happen pretty much automatically with the intention that you'll be meeting with one of our staff at some point later to learn more about what could be helpful to you. The standard one where you meet with somebody is 50 minutes, and that's especially for people who haven't done this before or didn't know it existed. Meet with somebody for 50 minutes. That's the better way to do it. Then there's accelerated, that's 30 minutes. That's more for people who have done this before, or it's been several years since they've connected with an accessible learning services. So they kind of have a feel for it and they know what to look for. Some people try to say, oh, accelerated will just get me my things faster, but you still have to do all the intake stuff and learn everything within that 30 minutes. So it usually leads to like a couple more appointments. So it's better just to do if you're new to this, do the standard 50-minute one. If you have some experience with it, 30 minutes will probably do. Don't forget to prepare questions. Ask how you can be helped, or ask why something is that way, or how something works. And then you'll understand how to use, your time at post-secondary effectively. So if you have any questions about SWAC, back to that email again, swac@humber.ca, and the numbers are there. These are all over the websites. You can certainly find them on our webpage. If you Google Accessible Learning Services Humber, you'll find our webpage, and we have all these connection points there. So that's about it. Thank you for letting me speak and showing you this stuff, and certainly let me know if you have any questions.
Awesome. Thank you so much, Jeffrey. I know that there are a few questions in the chat, so thank you for everyone who is engaging with us today. So first question is from Anthony, and I know one of our specialists did respond, but just for those of you who are listening, Anthony had asked, can we get our eyes here too? I'm assuming for an optometrist, are you able to access that service? Is that available?
The campus doesn't have an optometrist that I'm aware of. Usually we refer people to their family doctor to suggest one or ask them to find one. So we don't really have a list. It depends on what you're looking for and what's close to you, I suppose. But yeah, Humber doesn't really have an optometrist per se. Uh, we don't really have access to doctors except with the health center, and that's for health center things. But sometimes the health center can refer you as well if you don't have a family doctor.
Perfect. Thank you. Next question is from Spider Girl. Is it possible to receive ADHD coaching at Humber as well?
It is. You can do that at Humber. If somebody has ADHD, even if they're not hooked up with accessible learning services, they can just find a coach and, it will cost per service. I think usually they're near $100 per session. So it's about how much that costs. But if you are registered with accessible learning services and we're supporting you in the ADHD, um, ideally, you'd be eligible for OSAP. We tell all of our students that are registering with us, see if you're eligible for OSAP. Apply. You don't have to take the loan. Apply, see if you're eligible. When we get to the disability funding part, then you're already eligible. You don't have to check that. There is, like, OSAP has a bursary for students with disabilities. They sometimes pay for the coaching. It depends on your categories and things OSAP's decided about you. But some people access ADHD coaching and ASD coaching through the bursary, or if they're not going to be using the bursary, they might use their disability grant to pay for that. But they can. Oh, what else was I going to say? Uh, I think that's about it. Let me wrap that question.
No worries. Thank you so much. There's a great question from Brittany, and I'm sure there's a lot of people in this situation as well, where they may not have been previously diagnosed, or maybe they didn't have an IEP coming out of high school, for example. So the question is, are you able to get tested for a learning disability? Like if you believe that you have learning struggles, but have never been diagnosed, what are kind of the proper channels? Is there an opportunity to get tested at Humber for that?
There is an opportunity. It won't necessarily be at Humber, but we have an internal process for people who wish to go through and find somebody and have an assessment. Usually for medical kind of things, we refer you to a doctor to fill out one of those forms. For ADHD, for learning disability, and for ASD, those are things that usually require a formal assessment with a psychologist. So if you and their consultant would discuss that, and they would say, yeah, it sounds like the things you're describing could be that. If you want to do an assessment, you access the bursary. So with us, somebody would access the bursary for funding for their assessment, and it varies how much you would get. And we have a list of people that we usually use. So we have a pretty quick list of assessors you can connect to. So there is a process, and it's driven by the student, and you get to pick the assessor, where they are, what tests you're going to do, that sort of thing. So you can do it through our internal process. Occasionally we have somebody who just says, do you know anybody? I know what I'm doing. I'll just go. We let them know who we usually deal with. So you don't need to go through us. If you are with us, certainly we want to have you properly identified with something that we are supporting, not identified in, no one's in a separate stream or anything like that, but you do have something that we are supporting, and it's good to have good documentation for that.
Perfect. And there's another question that just came in, just to piggyback off of that, the topic that we're on. Rocky asks, is there any way to get support for disabilities that aren't professionally diagnosed, but you're sure that you have? Is there a way to still receive accommodations, or does everyone have to go through that channel of becoming professionally diagnosed in order to receive accommodations?
That's a good question. I haven't had that one before. The transitional appointment, the intake that I mentioned earlier at the QR code, You can get accommodations there if you suspect you have a disability, and you just get some basic accommodations like extra time in the test center, using a computer. Those things are, you can get an accommodation letter that says that, and your professors will accommodate you. The test center will accommodate you. So they're basic. If you need something more specific for a very specific thing that maybe you haven't been diagnosed for, then yeah, we'll lean toward getting a professional diagnosis on that. And the better part of getting professionally diagnosed is that then there's funding available. Like there's a reward at the end of that, for lack of a better term. But yeah, you don't have to be professionally diagnosed. You can get started. You can even meet with somebody and be working on it. But eventually, if you can be, that's usually better and much more clear, and you have a really good idea of what you're working with.
Awesome. Thank you for that. And thank you again for everyone who's actually putting these questions in the chat. I know that some people are shy, and I'm sure there's many people who are going through the same situation that you are. So again, thank you for kind of putting those questions in the chat. Next question is from Ms. Gana. Do we get vaccination service too if we don't have a family doctor?
Vaccination service, it depends on when the health center is running something like a flu clinic. They announce it. They put up signs for it, so about a month ahead of time when they're going to do a flu clinic. That has been off and on since COVID, but it has been. I think they've had one recently, so there's that. For other vaccinations, it's not just like general health vaccinations. It would be something related to a program. So if you were in a nursing program, there's a certain number of vaccinations you have to have before you can go into a workplace and work with patients. So yes, the test center does those, or the health center does those.
Thank you. Next question is from Amenzi. What if I have accommodations from a previous college? I'm assuming maybe they're asking if it follows them or if they have to book like a brand new appointment and set that all up all over again with Humber.
Yes, good points and good question. Any accommodation letter you might have had from another school is part of helpful documentation. So certainly bring that. Nothing transfers, or we can't ask your other school to send everything. You have to do that. So everybody who comes to Accessible Learning, we can't really look for people with disabilities. They have to come to us. So you have to self-identify, show an old accommodation letter, old documentation, or even recent documentation. But you have to start the process again. But if you're used to it, it goes pretty quickly because it's very similar at most of the colleges and universities. If you need something very specific, then of course the specific documentation that allowed you to get that accommodation will be necessary. So certainly bring and share that.
Perfect. Thank you. This is from Deborah. If students are starting in the fall, when should they kind of start setting up appointments? When does that open up for everybody?
It's a good question. Ideally, when somebody works with particularly a new student to Humber, they would need a schedule. When the consultants work with somebody, it's best to have classes to look at and apply all this information to. So July is good, late June or July. Once you have a schedule, that's good. We see people all year round. So if somebody was starting new in the fall and didn't have their accommodations set up by the first day, that's not a big deal. Like you have months to put those in place. So you can still be accommodated even if it has to go quickly after a few weeks. So we see people any time of year to get started for fall. The earliest, I would say June or July. If you're somebody who anticipates needing a lot of accommodations or even external support like attendant care, start earlier. Like now is fine. Anytime March forward, if you have a fairly complex disability, and anytime is good. But yeah, late June or July is good. When you have a schedule is best. And then if you're not quite all set up by the second week of September, it's okay. We'll have things in place with you, by the time you have tests and things.
Perfect. Thank you so much. Question is from Deborah again. Do we assist with the Ontario bursary for students with disabilities?
Do we as in ALS? I presume that one
I
is.
believe maybe financial aid. I'm not sure.
Um, the if it's disability related, so it would be the bursary for students with disabilities. ALS has to do that with each student. Like, we're part of the approval process. The student is applying to that to see if OSAP will give them that. And there's some things that go along with it to get that approved. As far as applying to OSAP, that's usually financial aids department.
Right.
They can help with that, and they have FAQs on that. But somebody, I would say, even though the paperwork is on the OSAP website for the bursary for students with disabilities, you can't really fill it out on your own. You have to fill it out with somebody here and go through the proper channels. So I wouldn't do that. I wouldn't start it on your own. I would meet with Accessible Learning Services and then say you want to do something with that, and then you'll find out how.
Perfect. Amazing. I think that is all the questions that we have so far. So maybe we will wrap it up. And again, if anyone does have questions that might come up later on, the email, Jeffrey, was again
SWAC@humber.ca.
SWAC@humber.ca. Thank you. And then if you have any kind of like general Humber questions that might pop up, feel free to kind of email us, student.recruitment at student.recruitment@humber.ca, and one of us and our advisors will be able to answer that. So we'll wrap up now. Thanks so much for everyone who tuned in and all the questions that were asked in the chat. Once again, be sure to stay connected with us. Subscribe to our Ask Humber sessions and to our YouTube channel. And then you can also join us next week. We do have on June 6th, our next session, which is going to be streaming live. And it's featuring our culinary, baking, hospitality, and all of our events programs. So you won't want to miss that. And that's it for us. I hope everyone enjoys the rest of your day and the rest of your week, and hope you enjoyed all the information that you got at today's session of Ask Humber. Thanks again, everyone.
Thanks. Bye.